Awareness, all right, slow down, Chulasis. Turning awareness into action, that's the purpose of the first International Mental Health Action Day taking place today. The COVID-19 pandemic has worsened mental health conditions in this country and in fact around the world. President of the Pan-African Psychology Union, Professor Sats Cooper, joins us now to discuss the impact of acting to improve mental health. Prof. Cooper, always a pleasure talking to you. I always say this is a conversation that we can never have enough of, right? Because in as much as, we try and raise awareness, turning awareness into action, it seems, is a bit of a challenge. And that's where a day like today comes in.
Yes, you've hit the nail on the head, Tulasizwe. We always think about it, but then tend to forget or, for one reason or the other, avoid taking that action. And I think in this country, we have very little mental health supports. We have very little institutional support, and the health care workers themselves in this pandemic period are in need of such support. So we are literally seeing something that is getting worse by the day if we don't do common sense things and get the necessary kinds of support from government to keep them to the policies that they have talked about, but which are not being implemented.
I suppose in a way it's a positive, Prof, that the good people at SADC, the South African Depression and Anxiety Group, say that they are receiving some 1,400 calls a day to their helpline. I say it's a good thing in a sense that people are reaching out, but I do imagine that in terms of the scale of the problem out there, that's the tip of the iceberg.
Yes, very clearly, and I think that, NGOs like SADC do a hell of a lot to help people who reach out to them. And it tends to be middle-class people mostly, and people in the cities who seek this health, modifying, helping behavior. And for many, particularly our children, our teenagers, our youth, older people, this pandemic and the conditions it has unfurled can provide serious stress and anxiety in their lives. And all of us react very differently depending on our own experiences, our own socialization, and very plainly, what happens at home? Do we have that kind of support system in the house? But as you know, about half of our people in this country don't have homes that have these kinds of supports. So it is up to us in the public domain and media like yours to put out the messages in an understandable way so that people can benefit from them.
So what does taking action look like for an individual, for example, starting from, an internal focus, but also externally in the environment? What practically do we do to promote mental health on this day?
Well, I think it's, if we look at your life, look at my life and say, what has happened now over the last few months that's different from what happened before? And if we find any of the symptoms that I'm going to just mention very briefly happening, then we know that there's a problem. For instance, anxiety, the sense of loss of control, loss of a sense of belonging and connecting to other people. There can be a feeling of hopelessness. Of course, there's a physical aspect of insecurity. The economic aspects that join that with unemployment, or not knowing what's going to happen financially. Then there's the fear of infection. We should not ignore the fact that many people out there are totally terrified of being infected, and they cover that up by anger, they cover that up by avoidance, avoiding situations, and also turning in on themselves. So I'm just giving you some of the things that are likely to happen, but they will differ according to the individual. There'll be feelings of fear, anger, sadness, and inability to focus on issues at hand, difficulty in concentrating, difficulties with sleep, and odd behaviors, overeating, not talking as much, or contrarily talking too much, and then physical symptoms that all of a sudden appear, which we, headaches, body pains, stomach issues, etc., that we've not had before, and there's no physical basis for that. So the symptoms are legion to Lasizwe. They're not just, simple ones.
Lastly, Prof, what does taking action look like from the policy makers and policy implementers? Just to cite what Casey Chambers from SADC writes in the Daily Maverick about, South Africa had a mental health crisis even before COVID-19. COVID-19 has exacerbated the situation, but it was already there, and she cites the situation around life acidemia and the death of those mental health patients who had been moved from various facilities as an example of this. If a tragedy like that did not jolt policymakers into, increasing their efforts and their actions, what will it take? What does action look like for policymakers and implementers?
I think they've become accustomed to us not raising these issues. They always put out these statements that X and Y will happen. But, the reality is that I think they are stuck. They don't know what to do. Their advisors in those spheres actually should be removed. They should hear the people on the ground, the people who have the skills, the psychiatry, the psychology, the other communities where there's serious expertise and knowledge. Utilize those, fire or retrain the people you rely on who during this pandemic are hiding from dealing with the issues. The problems are not going to go away, and we're going to see more of this as we go into the election, because we'll be in pandemic mode for the next 2 years. Our vaccine rollout is beginning to happen, but it is far from ideal, and all the frustrations, all the angers are going to be revealed as we hit the second half of this year.
All right, Professor Sats Cooper, thank you so much. I appreciate your time. He's the president of the Pan-African Psychology Union. By the way, that number, that helpline for the South African Depression and Anxiety Group is very busy. I mean, they're receiving something in the region of 1,500 calls per day, and that is double the volumes they used to receive before the onset of the pandemic. That number is 0800 567 567 0800 567 567. Do take action on issues of mental health.